Hello, everyone. Today we're going to talk about phantom limb syndrome and the treatment that has been shown to be effective. The term phantom limb was coined by physician Silas Ware Mitchell in 1871, where he built his career as the father of American neurology on the ghostly pain that lingered in veterans in the aftermath of the Civil War. Phantom limb syndrome can be defined as having a feeling of sensation in the limbs that have existed before but removed with amputation. This sensation can be the feeling of an itch, cramp, or burning, stabbing, and piercing pain seemingly coming from the missing limb, as if it were still attached to the body. It has been reported to occur in 80 to 100% of amputees, and most report painful sensations. In a typical limb, a detection of a physical stimulus will result in a signal that is sent to the corresponding neurons in the brain. The interpretation of this stimulus is one's perception of the stimulus. Although this phenomenon is not fully understood, scientists have discovered evidence that with phantom limb syndrome, the brain still continues to get messages from the damaged nerves and thus creates a sense of perception. Vilayaner S. Ramachandran, a prominent neuroscientist, hypothesized that the reorganization of the brain's neural connections in the somatosensory cortex caused the sensations felt by patients. He and other colleagues illustrated this hypothesis through the sensory homunculus, which is a map along the cerebral cortex of where each part of the body is processed. A common therapy used by doctors to treat amputees with phantom limb syndrome is something called mirror box therapy. It works by essentially tricking the brain into perceiving that both limbs are intact and functional, then the pain that the amputee is experiencing in the phantom limb will subside. This therapy is possible due to a phenomenon called bottom-up processing. Someone can build up to a perception using pieces of sensory information that they gather from the environment for the first time. The subject is seeing the reflected image and it appears as if the phantom limb is moving. Through the use of this artificial visual feedback, it becomes possible for the patient to move the phantom limb and to unclench it from potentially painful positions. Today we reviewed phantom limb syndrome and how it has the potential to create the illusion of sensation within amputee patients. Thank you so much for listening.